what should an athlete do if they have an advanced sports injury? In other words, it's really, really serious. Like, in other words, either the injury itself is very, very severe, or they've had the injury for a long time. And trust me, man, it can get really, really discouraging. I remember a gal who was a marathon runner, and unfortunately, her injury, she was letting herself get so depressed that it was almost as if life was over. And I had to say to her, Mary, I said, you know as well as I do, there's a lot of people that love you. You got great friends. You got a wonderful job. I said, don't let that define you. So the first part of our care really related to that. It's like, don't let your athletic endeavors define you. Yeah, Dr. Hauser's done 5 Ironmans. Yeah, I've done 2 ultra marathons. And people don't know this, but for the last several months, I've done almost no exercise. In other words, I'm not going to let, just by choice, by choice, I'm doing a lot of writing, and the office has been really busy, and I've had other projects to do. So I haven't let, just because I'm not exercising like that, define me. So having said that, as I said to Mary, I said, Mary, we're going to get you back to running. It may take, 3 months, 4 months, 6 months, but I want to tell you, first of all, you still can exercise hours a day. She had a back injury, so she couldn't run, but she could do other things. So her and I talked about all the other exercises that she could do. So just because you can't run, that's why they have swimming, and that's why they have, Pilates, and that's why they, there's a million different kinds of exercises. So sometimes athletes, the first thing they got to do is don't let an injury define you. You're a wonderful person. I believe made in the image of God. You have a lot of people around you that love you. And 2 is, just because you can't do a certain sport that you love, like in other words, you can't play racquetball. So you're saying, don't let racquetball define you or get you depressed. There's a lot of other exercises. And I said, when you're injured, it's really the opportunity to do all the things that will make you a better athlete in the sport that you love. Give you an example, almost everybody can do balance work. When you play racquetball, balance is really important, or when you run, balance is very important, and we all know that core strength is very important. So in other words, while you can't play racquetball because of your injury, why don't you do exercises that will help you in the end be better at it? And most athletes don't do enough endurance training. And there's lots of different ways to endurance training. You can do endurance training by getting an aqua jogger and running in a pool. Even if you can't swim, you can still do the kickboard. And obviously I'm a strong advocate of swimming, because I think swimming is, the best, athletic thing a person can do, because it works all the muscles. So you can work on your endurance with swimming, or for instance, if you can't run, you might be able to do the elliptical. So just, in other words, you might be in a racquetball sport where it's sprinting, but why not work on your endurance? So as you build your endurance, it's going to make you better, in the second game of a match or toward the end of a match. You're not going to get tired. Now, as it relates to your injury, prolotherapy is the opposite of almost every other treatment. So don't be dissuaded because you haven't had any other success with other treatments. Prolotherapy stimulates the repair of basically tissues that often don't repair by themselves. Like muscle tissue, you get a muscle injury, you put heat on it, you rest it, you exercise it. Whatever you do, it typically gets better because it has such a good blood supply. Tendons, crappy blood supply. Meniscus, only 1/4 of the meniscus has a blood supply. The rest of it is by joint fluid. It gets nutrition by joint fluid. Labrum, terrible blood supply. So in other words, these tissues look white. A tissue that looks white, whereas muscle tissue is red, so it has a good blood supply. Tendons are white, meniscus is white, most of it, labrum's white, ligaments are white, terrible blood supply. The neat thing about prolotherapy is the injections are done exactly where the injury is. So in other words, we're either injecting substances that stimulate cells to replicate, or sometimes we actually inject the cells right there. We could take cells from your blood, that's called platelet-rich plasma prolotherapy, or I could take out bone marrow, that's called bone marrow prolotherapy. A good website is to go to www.stemcellprolotherapy.com or www.bonemarrowprolotherapy to learn more about those techniques. You can also get stem cells from fat, but typically just normal prolotherapy with dextrose or sodium moreuate or various hormones. The normal prolotherapy works great for whether it's an acute sports injury or chronic sports injury, because most injuries that don't heal, it's from joint instability. Any athlete who's got like a clicking sound, you got a clicking sound in your neck when you move it, clicking sound in your back, clicking sound in your knee, it's the joint's unstable. That's why the other treatments haven't worked. You have to cause a tightening and strengthening of the ligaments or meniscus, and then the joint becomes stable, then the pain goes away. So most of the time, even with advanced sports injuries, we get the athletes back to the sport. Sometimes they have to be a little bit patient because the repair of those tissues takes time. But most of the athletes, they're fine, doc, hey, if it takes 6 months, but I can run the rest of my life, I'm all for it.